Welcome to Gizmos. This is Andy Schumann with another medical technology review. I have the pleasure and privilege of interviewing two folks who are associated with RemmieHealth. The CTO of the company is Jan Wang, and the CEO is Jane Zhang. So welcome both of you, and thank you for your time today. So I thought we'd start with Jane. So I understand you're a mom as well as a CEO of a startup. And what led you to start the company was your younger child had a lot of ear infections. So could you tell us a little bit about that?
Yeah, absolutely. Thank you, Andy. My name is Jane Zhang. Thank you so much for the opportunity to be on this program. I am the CEO for RemmieHealth. The reason why I started the company was definitely, like you said, when my younger son started preschool or going to childcare for the first time, we were not prepared for the series of diseases and sickness that he had to go through, which were low and common acuities that often impacts children in the first year or second year that they go to childcare, and all the way lasting to their childhood. Basically, he had 4 different ear infections within the first year. We had to see the doctors 5 times, and one of the episodes lasted 40 days because it was under control. He was allergic to antibiotics. We got rejected for second opinion. We were lastly misdiagnosed because he had hand-to-mouth disease instead of ear infections. And multiple times he woke up in the middle of the night, so we had to go to the ER. And it was at that time that I thought only if I had a monitor for his conditions myself. And I was also told by an ENT specialist that if we monitor the ear frequent enough or see fluids building up, we can give him a nasal wash and he did not have to go through the infection. We were very close to having to put ear tubes in his ear, but we nearly missed it. We were able to not having to go through that, but talking to many parents, I know that's what they went through. I basically built this idea. I thought only if I had a monitor and also was able to connect with this physician, as I needed it on demand so that they can guide me on how to use this device, which they often do. They use this otoscope device in their office to look in the eardrum and nose and throat before diagnosis. I thought this could be used in a home setting by the families themselves, and the physicians could be alongside and provide guidance on how to use the device and how to interpret the symptoms. That's when I leverage my background in biomedical engineering. I have a PhD in biomedical engineering, building diagnostics for low resource settings. I thought this is an opportunity for me to build it up.
I see. So how did you go about developing the otoscope?
So I happen to have a mechanical engineering background, and also my husband can help me with the drawings. We printed up as a cell phone attachment first at home. We put in the optics ourselves. We happen to both have a master in biomedical optics. So we put the optics in and then started testing it using the cell phone. And we noticed that because his cell phone and mine were different, the lights and the camera were at different locations. We need different fixtures for the cell phone, and looking at everyone else's phone, we can't keep up with the different types of printing we need. And then, we 3D printed another type, which is very similar to the physicians, in shape. There's a hold. We actually administered a survey asking the users what types of shape they would be interested in. Is it a pen? Is it a hammer? Is it a handle? And a lot of people actually picked the handle type because that makes it firm and ergonomic and safe to handle. And if it mimics how the physicians are using it, then they would be more likely to endorse. And ultimately, the circuitry we outsourced to a contract manufacturer based on their experience in endoscopy manufacturing practices. They would be able to make the device based on our design and combined with industrial scaling up in terms of manufacturing.
Okay. So my understanding is that because a otoscope, I think it's a class 1 device, isn't it, from the
Mhm.
FDA? So you didn't have to go through the long and expensive process of getting FDA approval. Is that correct?
Correct. So we are listed as a class 1 device, and the it's 510(k) exempt. So we have a predicate of existing otoscopes in the physician's office to benchmark our claims with.
Okay.
And in our, I think one of the difference is we do have a app that accommodates the device that receives the signal coming from the device in terms of image, video, and text symptoms input. So the app is something that is similar to the physician's eyes, in
Right.
the traditional conventional device.
And let me ask, and excuse me for mispronouncing, but it's Jan Wang? Jan, okay.
Yeah.
So as CTO, what problems did you have to overcome? And how long did it take the company to develop the device as well as the app?
I think since I joined last June, so before I joined, we have already had the device already. But when I joined, I think we have a lot. I have a lot of things to do. So firstly, is the hardware. Anything involved with hardware is super complicated, and software is kind of more time consuming and money consuming for making any change of the hardware. And dealing with the Wi-Fi problem, we spend a lot of time on it. And the other part is the software. And software is before I came, it was just local functionalities, but I'm trying to build more and more to telemedicine. So establish more functionalities of all the bring in the internet ideas about how to make it a device, not just a home use, but for the telemedicine era. So that is the main two main parts I've been working on. Yeah.
Right. I see. Okay, very interesting. So at the moment, Jane, do you are you you're out of beta? You're the product's available on the market. It's available on Amazon. Have you sold a ton of these yet, or you're just starting out?
Like John mentioned, we converted the product from just a isolated device where the users would just be given a device and told to do it at home by themselves, whatever they want. We try to link them up with a physician. We try to build the cloud data availability for them so that it will be everywhere available to them, regardless of their devices and location. And we also build out the app so that it's more user friendly, as well as an SDK so that this could be integrated in the backend with any telemedicine service providers that as the users prefer. It could be the clinicians or the patients. We are selling on Amazon our retail version of the product where the users can leverage our build of the app and link up with a telemedicine service provider associated with one of our partners within the app by paying a ad hoc urgent care fee or on a monthly subscription basis.
Mhm.
The sales went through a beta sale earlier on where we were fine tuning the usability and the user experience, and then we took a pulse, we iterate on the product, and last August, or actually October, when we were launched on Amazon with a limited release of the product.
Mhm.
The sales has been really pretty good. We have not done too much promotion. There's no paid marketing. There's no advertisement everywhere. We have not had the budget or the spend too much effort on that promotion. And our sales is pretty good. We've gotten about many reviews of the product, and it's easily available.
Okay, so you have been selling these. You're not promoting it yet, but I imagine you sold dozens, perhaps hundreds, but not thousands or more. Uh,
Correct.
and Jan, I'm just curious because you did send me a unit which looks terrific. Okay, it's very ergonomic. I think you selected the color very appropriately, and it's very soothing. It's not threatening to a child. So I'm curious because I didn't have a lot of opportunity to play around with the app, but it connects by way of this is essentially a router, a hotspot, and my phone connects to it. But why wireless versus Bluetooth? I'm just curious from a technical point of view.
I can take this question. So Bluetooth is you actually never see any device using Bluetooth to do the video streaming. Very not a broad bandwidth channel. So you can use the Bluetooth phone, right? Bluetooth ear headphone,
Right,
but it's not for video. This amount of data is only available
understand.
for
So it's video,
there.
which is high data, because a lot of
Yeah.
the devices I review, like stethoscopes, they do transmit EKGs, which is visual, but not a video. So I understand. So that makes good
Yeah.
sense to me. Okay.
Yeah.
And Jane, could you explain, how to use the device? I know you've got a very nice manual. One can use the phone to scan a QR code, and it automatically connects you to the App Store where you can download. I assume the app is free if you buy
Right.
the Otoscope. And tell us about the buttons on it and how you use it.
We do have 3 buttons in the back. If you show the device, if you see it, there's a power button on the bottom. The lighting can be adjusted in the middle, and then the snapping image is on the top. So you would be able to basically turn on the device by pressing and hold. I'm turning off my background so you can see it better. You can pressing and hold the bottom button for about 3 seconds, and then the light will stay on. And when it starts to flash, that's when the Wi-Fi is transmitting. And you can start connecting the phone through the settings and go to the network that starts with Otoscope. So that's when it's ready to connect.
Okay. And I noticed I had to fool around with it a little bit, but I got a very good image of a normal TM, mine,
Yeah.
earlier today. So it's very impressive. Now, do you intend the device to be used for recording the pharynx as well? Is it primarily the ear that you're interested in? Because it's different optics involved in doing the pharynx.
We do think that it could be for the throat. So that's what yes. So, and I had pretty good images of my throat when I turn up the lighting,
You increase
by
the
pressing
light.
it 4 times. There's three different levels of lightings, and at the top level of lighting, and at the good working distance of the pharynx, between the tip and the pharynx, I was able to get a good image of my as connected.
Yeah.
And if I turn on the lighting, so there are 3 different levels, 1, 2, 3. So the lights get brighter. And when
Now, you said that you are associating this with telehealth, and I am familiar with Anytime Pediatrics. So you are establishing a relationship with them or others to integrate this into telehealth?
Yeah, so there are 2 different aspects on how we're working with the telemedicine company, especially with Anytime Pediatrics. We think that the otoscope could really strengthen, if the patients or families have a device at home, it could very much strengthen that visit experience. So the physicians would be able to see the symptoms that the families are complaining about and provide a closed loop decision, whether or not it's to come in person or to get a prescription right away, instead of having the patients to come in person for the visuals. On the other hand, the technology, we think, so Jan, maybe you want to elaborate a little bit on the technology interface, but essentially we're building out a software development kit for Anytime Pediatrics and any other telemedicine platforms, so that they would be able to incorporate and basically allow the device connectivity on their platform.
I see. Okay. And looking at the future, and as someone who writes a lot about telemedicine and teletechnologies, are you looking at integrating auscultation or other capabilities into your device, or creating another complementary device?
On our roadmap right now, we wanted to be focused on the otoscope and make it right and build it out so that this, there's a good demand. We would say a big market for the tool as is. In the future, we don't rule out the possibility of building, complementary devices to fill in additional gaps for these telemedicine visits. For now, we'd like to focus on this particular tool and the applications.
Okay. That sounds very good. So I would like to thank you both for joining us and telling us about RemmieHealth and your very interesting and very appealing device. And I'm asking the audience to contact RemmieHealth.com if they're interested in learning more about the device. It is available on Amazon.